Okay, hi everyone. Thank you so much for being here and joining us today for this webinar titled Working with Respondents in Sexual Misconduct Cases, Perspectives from Practitioners. We're a team of researchers, of scholar practitioners housed in the McCluskey Center for Violence Prevention at the University of Utah. My name is Nadika Karnokna, my pronouns are she, hers, and I currently work as a research associate at the MCVP, or the McCluskey Center for Violence Prevention at the University of Utah. I have a background in student affairs and violence prevention and cultural centers, and I'm also a trauma-informed yoga instructor. This team, there's 3 of us here today, but this team is made up of 7 scholar practitioners who worked in a variety of different capacities: Title IX coordinators, case managers, student conduct administrators, and several also being enrolled as graduate students. So I'm going to allow Megan and Julia to introduce themselves.
Hello, as Nidika mentioned, my name is Megan Carbley. I use she, her pronouns, and in addition to being a research affiliate with the MCVP, I serve as a Title IX coordinator and director of compliance at Elon University in Central North Carolina. And I've been a practitioner in student affairs and Title IX for a little over 10 years. And I've had the opportunity to not only work with respondents, but also support complainants prior to coming into my role. And I'm really interested in the ways that we as practitioners experience not only enforcing, but supporting students through adjudication processes and systems. And so we're really excited to share their research with you today about these practitioners.
And my name's Julia Broussard. In addition to this work with the McCluskey Center for Violence Prevention, I serve as the Title IX coordinator and assistant provost for Title IX compliance and education at Tulane University. I have been working in higher ed for over 10 years. My background is in clinical social work, and I started off working with students who were victims of crime before moving to a role in case management, where I was working then with both victims and respondents before moving to the Title IX office, where I've been for the past few years.
Thank you both. So we're looking forward to sharing really highlighting the findings of this research with you all today. We wanted to start with a land and labor acknowledgement. So wherever you are listening to this webinar, to this presentation, I invite you to take a moment to settle into your space. Maybe you're listening at your desk, maybe you're listening while engaging in another activity, but wherever you are, if it feels right, maybe you take an intentional inhale in and a soothing exhale out. Maybe one more inhale together and an exhale out. And while we're in this moment of presence, I want to honor the land that I reside on. I live and work in what's now known as the San Francisco Bay Area on the land of the Muwekma and Ramaytush Ohlone peoples. The University of Utah, which houses this research, occupies the land of the Bannock, Goshute, Navajo, Paiute, Shoshone, and Ute peoples. This land was stolen by violence and force, including through the use of sexual violence, which we're going to be talking about in our time together. So as we spend a few more moments in the space of awareness, I invite you to consider the land that you are on and the peoples who steward this land historically and presently. I invite you to reflect on your responsibility to the land and those peoples, especially as we engage in the work of sexual violence prevention and response. Thank you. We also wanted to talk about the context of our work and what brings the 3 of us together here today, this research team together, and what guides this research that we'll be talking about. So in the fall of 2018, Lauren McCluskey, an undergraduate student at the University of Utah, was murdered on campus by a man she had briefly dated. In the aftermath of this immense tragedy, campus community members came together to find ways to address and prevent sexual and relationship violence on campus and beyond. So one of those strategies was the creation of the Center for Violence Prevention at the University of Utah, which was renamed the McCluskey Center for Violence Prevention in 2020. The same academic year that Lauren was murdered, in January 2019, Dr. Sarah Hawley, a medical resident on the health sciences campus at the U, was murdered by her partner in their home. Mackenzie Luke was murdered by someone she met on a dating site in summer 2019. And in February 2022, Chi Fan Dong, an undergraduate student, was murdered by a man that she dated. We believe it's essential and important to uplift the names of these 4 women, as their legacies are what bring us together in the MCVP, and their stories and those of other survivors and victims that we know and that we don't know. These stories guide our work in looking for ways to prevent these forms of violence in higher education and beyond. In particular, we came together as a research team to understand the experiences of respondents and those that work with them, because we believe that there are unmet opportunities for educating those who have caused or may cause harm, and therefore missed opportunities to prevent violence on our campuses. So we do this work because survivors ask us to, and we do this work to prevent violence. I wanted to highlight a couple of the learning outcomes that we've identified for this webinar and for our time today. We hope that after engaging with us today, you'll be able to describe at least 3 ways respondent service professionals experience their work. Be to identify at least 1 strategy to support people working with respondents on your home campus or organization, maybe that's you, and describe the difference between accountability and punishment. So our research team, I'm going to share a little bit about the background of the project, and Megan and Julie are going to dive and spend the most of our time diving into the findings today. So our team came together via this large call for scholar practitioners and researchers interested in engaging in critical research about interrupting sexual violence in higher education in 2023. We had an initial virtual meeting in May 2023, so over 2 years ago, and then we've met monthly on Zoom to conceptualize the study. We discussed in these meetings our scholarship, relevant scholarship. We examined our positionalities, shared our professional connections to this work, and this all led us to the specific purpose and research questions for this study. So given that formal work with and support of respondents is relatively new in higher education, there's not a ton of guidance that exists for practitioners engaging in this work that you might know as someone listening to this webinar. Further, given the stigma often associated with working with respondents, the implementation of respondent services programs can be confusing for those responsible for implementing and coordinating them. So consequently, as I mentioned previously, there are likely unmet opportunities for educating those who have caused harm or who may cause harm, and missed opportunities to prevent these forms of violence in higher education. So we developed this interview study to understand the ways respondent services professionals conceptualize their work, how their work contributes to addressing sexual misconduct on campuses, and what tools, resources, and practices might be necessary for improving the work. So we explore who is doing this work on college campuses and how those folks engaging with respondents in sexual misconduct cases conceptualize and experience their work. So we recruited participants through sharing recruitment emails on higher ed listservs and directly with individuals and organizations that engage in sexual violence prevention and response. Orgs like ATICSA, MASOC, NASPA's Cultural Respect Program. We also emailed offices that were listed as providing respondent services at AAU member institutions. In June and July 2024, so about a year ago, we interviewed 24 professionals who work with respondents to learn about their experiences and challenges. Each participant engaged in an individual 45 to 60-minute interview on Zoom with a member of our research team. These are some of the questions that we asked practitioners in interviews about we asked about their daily responsibilities and their roles, like what's a typical meeting with a student look like, an example if they had one of where a respondent may have had a moment of learning. And we also asked about the challenges and support they experience in their work, as well as their philosophy about engaging in respondent services work. The next few slides discuss some of the identities and demographics of participants. I won't spend too much time on this. We'll also have an accompanying report on our website. Of the 24 participants, 1 identified as non-binary, 7 as men, and 16 as women. A little over half, or 13, identified as white, 4 identified as Black or African American, 4 as Latina, 1 as multiracial, and 1 as Native American. 9 participants identified as queer or lesbian, gay, or bisexual, and 14 as heterosexual, and 6 identified as disabled, and 17 as non-disabled. Participants worked at a variety of institution types, primarily for 17 working at large public institutions, 5 worked at private institutions, and 1 worked at a mid-sized public institution. They also worked in a variety of offices on their respective campuses. 10 of them worked in either Dean of Students offices or student conduct. 6 worked in Title IX offices, and 4 worked in sexual violence prevention and response offices. The 4 remaining participants worked in other kinds of units that offered general student support, like case management outside of Dean of Students offices. To briefly touch on our data engagement processes or data analysis before we jump into the findings, we transcribed the recorded interviews with each participant, and a member of the research team who didn't conduct the interview cleaned these transcriptions, identifying information from the transcript to support confidentiality. We then listened to each transcript while reading, and this provided the initial round of data engagement, exposing members of our team to, again, more data than the interviews they conducted themselves. After all of the transcripts were reviewed and cleaned, 5 members of the research team engaged with the data using strategies of listening, annotating, and memoing that Wolgamith et al. Describe in their book, Expanding Thematic Approaches to Analysis. We each reviewed 2 transcripts each and developed tags that were large categories that we organized all of the transcripts and data into. There are 12 tags that we created, things like journeys to the work, logistics of the work, challenges of the work, and then 2 researchers that were different from the person who facilitated and cleaned each interview tagged each transcript to organize all of the data into these categories. And then we've read the data excerpts within each tag to further make meaning of the specific themes present across the interviews that Megan and Julia are going to be talking about next.
All right, so I think we're ready to dive into the findings where we'll talk about, who is doing this work, how are they doing this work, and in what context. So we'll start with the who. As you can see here, there's a variety of backgrounds in terms of education and work experience that folks are coming from. Most common was the traditional higher ed background. So folks who, maybe have a master's in higher ed administration or education and come from backgrounds in housing, conduct, fraternity and sorority life, and those types of fields. Second most common was folks who had come from the world of community rape crisis, domestic violence work, and then followed by, some sprinklings of folks who come from legal background but found themselves working in higher ed, or maybe like me, have a master's in social work and found themselves working in higher ed. Also, a couple folks who said they do systems work, and one person who's a research tech. In terms of personal relationships to violence and oppression, there were a significant number of folks who were primary or secondary survivors of intimate partner violence or interpersonal violence. Lots of folks who brought an equity and social justice lens to the work of healing, and looking at their work through an anti-oppression framework. And then again, a lot of folks who had worked in housing, conduct, fraternity and sorority life, and maybe had dealt with incidents of violence and harm within their duties in those roles. So another question that we wanted to talk with folks about is, what is their role specifically in working with respondents? One common theme that came up was, the way they get referrals, which are commonly coming from Title IX offices, reporting systems that universities have, which fall under different names, but are often called care reports, and peer referrals. And I think a quote from one of our participants, Joe, illustrates this. Joe says, "So I would say by and large, it was one of 2 things in terms of how they got referrals. It was either that they had received feedback from someone, like someone had a conversation with them about either the survivor themselves or friends of the survivor, or both of them were like, hey, I don't know if you know this, but like so-and-so says that you assaulted them. Or I don't know if you know this, but like you have a terrible understanding of consent." And so they had like received this feedback and were like, F, what do I do? And came to me. or they got referred by an RA or a student group leader or an athletic team leader who was like, hey, there's this chatter about you. I think you need to go to talk to Joe about this. So again, that just illustrates some of the different ways that referrals come in to folks. Another really interesting theme we found was that a lot of people were defining their role in terms of what they're not. So both for themselves personally, kind of defining their role in terms of I'm not a counselor, an advocate, a decision maker, I'm not confidential, but also in terms of how they communicated their role to students. And so I've got a few different quotes that actually illustrate this. Summer said, I'm not a cop, I'm not a judge. Joe said, I am not a clinician. I don't have a clinical background. I'm not a therapist. And so I'm really, really careful that I am not a treatment provider. Um, and then Morgan said, I'm not their defense attorney. I'm not their counselor. I'm not their friend. I'm their process guidance. And I think that ties into this next theme you see that a lot of folks saw their role as explaining the process to respondents. A lot of times the respondents are ending up in that person's office because they have been reported to the university for some type of harm. And so the folks in our studies saw themselves as basically helping explain the process. As you'll see in the next one too, explain and review the policies, the definitions that are often managed by the Office of Student Conduct or the Dean of Students office or the Title IX office. And so I have another quote from Morgan that illustrates some of that piece where she says, I'm their process guidance. Morgan also speaks to this next piece around boundaries and walls that folks in this role of working with respondents felt like they had to put up and have some kind of boundaries around the emotions that they could or couldn't show when they're working with these students, particularly if the students are going through, a conduct or dean of students or Title IX process. And so I've got, again, another quote here from Morgan that speaks to some of those boundaries that folks in this role put up. Morgan, talking about the respondents that come in to meet with them, say they want to debate and rehash and argue what happened and how that person's wrong and that person's crazy and that the person that they're lying. And I'm like, we're not here to talk about that. I will shut them down very quickly and say, no, I'm not here to talk about what happened in the past. And then Morgan goes on to say, I have to hear that and listen to that and very intentionally put up a wall. I set up a very structured meeting with them, the first one to make sure that I avoid that as much as possible. So the hardest part for me is trying to manage their emotions and keeping that boundary up as a professional. So again, you'll see that folks are kind of trying to walk this line and this role around what they are doing and what they're not doing. And then finally, we saw a theme come up of folks seeing their role as also doing some type of education or intervention for the respondents to try to, either prevent reoccurrences of the harm that the respondent may have engaged in and or to reintegrate them back into the campus community. And sometimes that was kind of informal psychosocial education that folks were doing. Sometimes it was a really formal curriculum like the STARSA program that's out there. But either way, that was a theme that emerged around trying to educate the respondents and kind of help them understand and change their behavior. All right, now we'll get into what are some of the philosophies that guide this work for our participants in this study. One big thing that came up is this idea of wanting to see equity in these processes, that there's a lot of resources, support out there for victims and survivors, as there should be, but folks weren't seeing that same level of kind of infrastructure and support for respondents. And Morgan has a quote that illustrates this philosophy. Morgan says, so in our process, complainants have access to a victim advocate. They can use that advocate if they want. They're given all kinds of resources, as they should have access to. And before the program and before this position was created, respondents didn't get anything. I mean, they were given notice and that was it. And so I was like, oh, that's really strange. Why would it not be equal? So this idea of trying to ensure that respondents have access to similar forms of support as they're navigating a process. And then as we kind of got into a little bit on the previous slide, a lot of folks were motivated by this philosophy around education and learning and growth for respondents. And a quote from Lisa illustrates that. Lisa says, I hope that these processes are not seen as punitive, but that they are seen as an opportunity for learning and for growth, for personal reflection and change in behavior. I feel like that is very much in alignment just with the purpose of higher education institutions in general. We're meant to be institutions of higher learning and the personal and development and growth that happens at the same time. I hope that what we're doing within our colleges and universities is setting up a process where it's an opportunity to learn and to grow. And again, that was really common of folks saying, higher ed is about learning and growing, and I see myself in this role as trying to contribute to that for the respondent. There was also real themes of seeing the humanity in respondents and having compassion for them. And that doesn't mean condoning the behavior, right? But seeing respondents as folks who are human beings and deserving of compassion. And Elizabeth has a quote that illustrates this. I think we have to acknowledge that maybe someone has caused harm. And certainly I've worked with respondents who have caused, I know they caused significant harm, right? And they are still a whole person and they're deserving of the compassion that I can give. And that compassion doesn't necessarily mean that there's not accountability for that, right? But I'm not going to write them off as a lost cause because, the more like there is a possibility, right? Where they could learn from listening and really engage with it. So again, you see that idea of these are folks that we need to see them as a whole person. And that compassion is going to go hand in hand with the accountability. And then finally, a theme that we saw was a philosophy around wanting to see healing for the respondents. And on the next slide, we have a quote from Gray that really goes in depth on this idea. Gray says, I work 99% with men, and we have a high rate of men of color as well. And so, the acknowledgement that there is an identity set of the mental health behind being a respondent, the mental health of going through an investigation, the lack of support that you have, one, as a man, two, as a man of color. I was just at a restorative justice training for sexual misconduct last week, and we talked a lot about that restorative justice provides, specifically in terms of sexual misconduct, provides a space for healing for those who think they don't deserve it. I see a lot of respondents who don't believe that they're worthy of conversation and don't believe that they're worthy of being human and being treated like that. And to sit with someone in that pain like no one else will acknowledge with them, I think just feels so purposeful. And I think when you experience someone else's healing, it's a very powerful moment to bear witness to. And so I think working with respondents, I get to bear witness to their journeys. I get to bear witness to their healing, to their growth, to their learning, to their acknowledgement of accountability and responsibility. And I get to facilitate that. I see it as a privilege and honor. I think that's just a really beautiful quote from Gray that actually touches on a lot of those themes we just talked about learning, growth, healing, and acknowledging the humanity of respondents. So, another question we asked is how are they getting education and training for this work with respondents? And we really found a huge range of things folks were doing, which maybe speaks to the fact that there's not kind of a professional home right now for folks who work with respondents. So they did talk about how some related professional associations like ASCA, which is for folks who work in student conduct, or NASPA, which is for student affairs professional, places like MASOC, which focuses on work with folks who commit or cause harm, that they were getting some training through those organizations, even if the primary focus of those organizations wasn't working with respondents in a college setting. And then also trainings through community or state sexual assault and domestic violence advocacy organizations, right? So I know here in Louisiana, we've got two state coalitions that focus on sexual assault and DV, and then local advocacy centers that all regularly offer trainings, right? So those types of spaces were important spaces for folks to get training. And then trying to stay up to date on campus resources and policies, I think both at a federal level in terms of what's going on with federal Title IX regulations and other policies, but also their specific campus. How are those regulations being interpreted and put into practice on their campus and their policies? And then folks also said they did a lot of campus-based trainings that, again, weren't directly focused on how do you work with respondents, but had a lot of good information that was still relevant to working with respondents. So things like trainings on trauma-informed support, DEI, mental health, QPR, which is a suicide response training, also trainings on threat assessment. And then finally, folks said that they did reading, seeking out articles and research that they could digest on their own to help them learn more. And one thing that was interesting, we had specifically on that threat assessment piece, we had a quote from one of the participants, Joe, who said there's a huge disconnect between behavioral intervention and student at-risk teams and people with actual knowledge of what constitutes risk from a respondent. So I think as this slide demonstrates, there's a lot of places where people are trying to get information and training, but we don't always have these trainings that speak directly to, threat assessment for college students who engage in sexual harm, right? Or there's not a professional association where folks who do that work can connect and get really tailored education and training for those roles. And then in terms of interventions, we found this theme around the tension between the idea of simply offering respondent services versus offering respondent support. And so services is kind of just focused on making sure the respondent knows about the resources on campus that are available to any student. So like the counseling center, making sure that they understand policies and definitions versus support that's a little more holistic and tailored to respondent needs. So things like making sure they're getting psychosocial education that might help them better understand and reflect on their behavior and potentially change that behavior. And you'll see on that psychosocial education side, we talked about this a little earlier, but we had folks who are sometimes doing that just informally in their roles, and then some folks who had really formal programs tailored to doing that education for respondents. And they found that in that work, there were themes of doing a lot of work with respondents around the respondents' reflections on their own personal experiences with trauma. And I have a short quote from Piper that illustrates that. Piper said, "A lot of times people who commit people who commit harm have trauma themselves. I've heard a lot of respondents say, I was sexually assaulted, or I didn't realize that counted as sexual assault. Like that happened to me before." There was also a lot of reflections on socialization and how that impacts respondent behavior. And again, I have a quote from TJ that illustrates this. TJ says, "I will typically ask questions that probably are questions they've never been asked before, like, how do you define consent for yourself? Because you're also allowed to practice consent. You can ask to receive consent, but you can also give consent. So what does that look like for you?" And this specific student that I'm thinking of, they had never thought about it for themselves. As someone who's male, he assumed that's not something he needs to do, like practice consent for yourself. And I've asked questions like, who taught you about this? Who talked to you about consent? Is that a conversation you had with people, like maybe your parents or family member or somebody? Just letting them know that once you can identify consent for yourself, it becomes easier to give consent or ask for consent. So again, this idea of helping them kind of unpack how they were socialized around these issues. And then also that psychosocial education involves a lot of work around helping respondents take on another person's perspective, particularly that victim's perspective, but it could also be maybe the perspective of the staff member that they're working with. And thinking about, intent versus impact. And so I have a couple quotes here that illustrate that. Lisa says, "I was having a conversation with someone once, and there was a fixation on the other party's unwillingness to give this person a second chance. He really wanted an opportunity to explain himself and to apologize, and she wasn't giving him the time of day to do that. And I said, she doesn't owe you anything." And in that moment, just like facial expression changed, he sat up in his seat and kind of put his elbows on his knees for a second. Normally, I wouldn't be so blunt in a conversation, but we'd had a few meetings, so we had some rapport. And I knew that this was like a little bit more of his style. And so I went for it in the moment of stating a true statement. I got to see the puzzle pieces kind of connect, with each other. And it got us on a really valuable conversation about entitlement and what are the factors that can contribute to this. And then Elizabeth also has a anecdote she shares about a time when she was able to offer that perspective to a respondent. So she's talking about an incident that occurred in the weight room on their campus, and she says, and then also offering the perspective. I was like, hey, can I offer you a different perspective? If you had raised your voice to me like that and threw down weights, I would be scared. As a woman, I would be scared that you're going to hurt me. And your intention was like, of course you wouldn't hurt her. But how does she know that when this happens a lot to women who don't know what a man has said and they see on the news that somebody was hurt or killed of it, hurt because of it or killed? And I think he was like, yeah, that's true. I probably really scared her. And she goes on to say, he owned it. He was like, I shouldn't have done that. I need to figure out how to express my frustration differently. And I was like, okay, how can we do that? So again, you'll see that ability to kind of offer a perspective and help the respondent see the perspective of the practitioner that they're working with, but maybe also the victim, led to some real aha moments for some of the respondents. And then finally, as I said, on the respondent services side, there are interventions more focused around helping respondents understand definitions and policies, and thinking about their behavior through that lens. And so Sean says, sometimes they may not agree with all of what's being alleged, but they recognize, like, yeah, I screwed up here. I don't think I did this, but I think I did this. And that's why they might. So it's like, okay, well, this is about critical thinking about, like, where do you think you might have caused harm, or where do you think you may have crossed that line into what's considered a violation? I've seen a spectrum of reactions to it, but some of the ones that tend to hit home more are the ones where they realize that their behavior wasn't only a violation of the rules, but a violation of their values. So again, seeing that by talking about it through the policy lens, folks are able to see how their behavior may have violated a policy. And then finally, folks talked about working with respondents in the context of reintegration programs. So maybe the respondent has left the community for a time, perhaps because of a suspension or something like that, and helping them to reintegrate back into the community. Also, possibly reintegration around any, negative social repercussions they may have had because of this incident or these allegations being known to others in the community. And I will turn it over to Megan now to talk more about our findings.
Yeah, thanks, Julia. So hopefully you started to pick up maybe a little bit on some of the context as well as the tensions that the practitioners felt, or at least you've noticed some different approaches. And so what we'll share now is about those contexts, and specifically, there are three intersections that we notice as the research team where we weren't necessarily able to separate these three out. Where, for example, participants talked about how they wish the process, an adjudication process could be better or more learning centered. That was frequently coupled with the challenges that they felt in being able to make the processes better. And then subsequently, those challenges being influenced by the fear of policy and compliance culture, and not necessarily in that order either. So we don't have a solution necessarily for what comes first, but ultimately that when we're thinking about the role practitioners play in respondent support or respondent services or some combination of the both, we heard from practitioners these three contexts that really influenced how they were showing up as practitioners throughout the research. So when we talked about whether or not folks felt challenged or what those challenges were in their work versus what made them feel supported, there were some themes that came up. So many folks talked about their supervisor and how that felt meaningful, processing spaces feeling meaningful, the ability to consult and brainstorm with others. Folks shared that often in this work, because it's kind of the job that they talked about no one else wanted, right? Oh, it must be so hard to do your job. And so that can feel isolating, right, to folks who really just need someone to brainstorm with and think through how do we address and support this individual within the constraints that we have. A reliance on state coalitions was really helpful for folks in this work. Oftentimes we think about state coalitions organizing around survivor support, but many noted there's much to learn from roles that folks have in advocacy. And then, of course, these networks, colleagues across other institutions. And so some ways that this showed up that we'll share with you, I think kind of speaking from the experience of the participants, and ways that the work environment was really important to them in terms of how they felt supported. Lisa shared, she said, I have the privilege of feeling very supported in what I do. I've got a fantastic team of folks that I work with, and I have an incredible supervisor that I report to directly that understands and really values the work that we do here. And he also provides me with a good amount of freedom and how I want to execute our program, and really looks to me as the expert in the work that we have to do here. So Lisa here is really sort of talking about what I think many of us see as the holy grail, right? Not only being trusted in the work and being able to see your vision and your team's vision through, but having the support to do that, which might be, for example, in contrast to those who feel a little bit more constrained by legislation and policy. Alternately, one of the participants shared some similar context, but added a few other pieces. So JC says, I have always had a very broad role where I have a high level of autonomy to really do what I think is right, develop areas of need and address any gaps that might exist. So do I feel supported? I do. Do I think others understand the work that I do, where I feel like I have people to talk to about, specific aspects of the work? That's where it's a little bit challenging. I don't feel like I necessarily have that within my reporting line, but we do have a system-wide monthly phone call where it's the respondent support people from all across the state. So I do get support from that group. So I'll say, yes, I feel supported, but it's in different ways from different people. So JC support, as we noticed in the theme, right, is really more so outside of the context of their institution, and using that to get support in their work, but probably also learn more about what's happening within the field across their state. And then finally, Rocky shares, we think broadly about how do we sustain one another in the work and provide resources beyond institutions and states. Rocky talks about the role of large organizations. So in this example, Rocky shares more broadly, there's the fact that I've been a part of ASCA for 20 years and I know people there. I know there's practically no one that won't take my call, and there are plenty of people who call me. So we're really relying on folks across our state and the US to help provide some of that support that we need in the work. One of the contexts around how folks felt supported was whether or not their institution understood the work they did. So you're seeing here on the screen a quote from Sadie. They sort of summarized one of the pieces that they were saying in reflection on this question. They said, I guess I don't feel supported. And here's some examples of that. So Yvonne shared, I very much feel supported as an individual doing the work. However, what doesn't feel supportive is when institutions don't understand the scope of the work that we do. Institutionally, I haven't yet felt super strong support for building Title IX offices. That's where I felt, in my career, it's been lacking. Like, yeah, we need Title IX because we have to have a coordinator, because we have to be compliant. And what do you mean you need more staff? Or do you need more support if you only had 4 investigations this year? So in some ways, I'm hoping that I can move up enough in an organization to really advocate for compliance, not just for compliance sake, but using compliance as a sort of jumping off point for providing more people and staff to support people in these processes. So here we see where folks are really identifying that institutions recognize the need for compliance. And in fact, many of us might be part of this conversation because we heard about respondent services or needing to provide respondent services because of the 2020 final rule, right? And as we think about what does it mean, not just to check the box, but to think about when we're talking about respondent support and respondent services, as Julia shared in the past several slides, we're talking about case management, ongoing and repeated contact with students and respondents to support them not only through navigating a system, but also providing learning opportunities. And I think it can be difficult, as Joe explains, in a quote that they shared, for institutions to really understand that because of what others shared, as Julia mentioned, somewhat of a reticence for institutions to provide services that might feel in the face of what complainants may be offered. So Joe shares, I did not feel supported when I was in that role in higher ed. I think that people were grateful. I think that I was doing a lot of work that other people were like, I don't know if I want to do that. So thank God Joe will talk to this kid because I don't want to. I think the lack of support was actually, they would do things policy-wise that were reflexively about respondent equity. That was a little bit disconnected. They were performing respondent equity without necessarily connecting that to the respondent's needs. And so the lack of support was actually a broader lack of support for the work as a whole, specifically wanting to do things at a surface perception level, not a deeper level to invest in the work properly. So I probably could have just read Joe's quote. I felt like they really explain that tension between what support looks like on paper versus how it shows up in practice in supporting different offices. So let's talk about this context of the federal policy versus the values and purpose within these offices. So in these spaces, there are some quotes here on the screen, and I'll read those to start to ground us in this conversation around the tension that federal policy posed for the participants around how they experienced and were able to enact their values and purpose. So River shared, sometimes the political climate can create challenges for the process. Kevin said, I don't think either party typically ends up leaving satisfied or feeling good about the process. Joe goes on to reflect, there's nothing about the process that encourages any kind of genuine accountability. And Desiree shared, no matter how many big-hearted, empathetic patient professionals sit on one side of the table, at some point, the system may dictate what is possible. And so what these quotes get at and what the participants are sharing with us here is feeling the tension around what, for example, as Julia shared earlier, many of our participants worked in student affairs for a very long time and or had student affairs backgrounds or counseling backgrounds. So presumably are going to approach meeting with students and what we were taught as student affairs professionals to be a compassionate, supportive way. However, some states, some legislations within those states as well as federally, gives folks the impression that we must strip away that feeling of connectedness to the student in order to be effective in our work. And one of the participants that Julia shared early on says that, I'm not here to be their counselor, and we're not suggesting that they should be, but they feel they have to draw this very clean line for the student in order to be compliant. And those roles, as participants shared, became more and more complicated even in the last few years with the changing regulatory field. For example, we thought that there may be some changes of 2024 regulations. Those were rescinded. And at the time we were doing this research, for context, we were in the middle of, when we were interviewing folks, it was just before what we thought would be the implementation of the 2024 final rule. And so we knew what that was going to look like, and folks were sitting in a space preparing for those potential changes. So a quote here that one of our participants shared around kind of this fear of being able to do the work or getting it right, so to speak. Piper shared, I feel like it mostly just instills fear. I think it's so scary to feel like you're going to break the law that a lot of times people won't try stuff. I went to this NASPA conference in March. I went to a lot of restorative justice presentations, and I met this one individual who worked in another college in my region, and they were like, how are you able to do this program? Like, how are confidential employees they're not allowed to do this and this and this. And I was like, well, I think we're allowed to do certain pieces of this. So why don't we find the gray areas and work within those? But it's just a huge fear that we're going to get in trouble for doing it. So here Piper and their colleague are talking about finding ways to live the value, but almost doing it in an incognito way. Kendra shares, I feel so stressed whenever a student asks me questions. My supervisor is so risk averse, and anytime a student asks me a question, her answer is always refer to the policy. Don't give your own answer. Let's say that again. The supervisor says, always refer to policy and don't give your own answer. Always refer to policy, sit there, right there with the student, look it up and find it in the policy, point at it. And so when a student has questions, I find myself feeling stressed because I know that I'm going to have to take time to look up every single answer. And then some of their questions are not easily answerable. So this professional's role, Kendra is experiencing a very hard line. And what some of us might refer to as a risk-averse climate, where Kendra's being directed to read policy anytime someone asks a question. So when we think about, what could respondent services and respondent support look like, if we're limited in being able to respond in the way Kendra is to students, there's a lot of growth for education. How might a student feel when they're being met with someone reciting policy to them? And then finally, one of the things that we saw as a research team within this subtheme of compliance culture, challenges, and desire for change revolved around the idea that Title IX processes don't work for anyone. The survivors are wanting the respondent to learn and not engage in the harmful behavior again, and the respondents want to be heard and not outcast. Even the staff doing this work don't believe the system is set up for accountability and justice. So what is the system set up for? As many participants shared, it's set up for compliance. And so we'll talk through, as Sean said, our North Star is federal and state compliance. So how do we start, or how did our respondents start to navigate, or how are they navigating holding that dissonance between supporting folks and also staying compliant within their state and the regulations? So moving on and finally talking about compliance versus effectiveness. So thinking about that. If we are compliant, does that mean we are effective? So we've talked about how folks feel that compliance instills fear. Confusion can be ineffective. And I've got a few quotes to talk about the impact of the rhetoric around Title IX, what title means, how often folks are using it as a verb. So, and then there was some confusion, and I want to share some quotes here. Not just confusion for the professionals doing the work, right? I mentioned the change, preparing for changes for the 2020 regulations around Title IX to 2024, and then back to 2020. And so Sadie shares that in 2020, when they came out with the new Title IX regulations that included cross-examination, our state created a policy that essentially bifurcated the sexual misconduct Title IX process. I'm using the phrase sexual misconduct because right now we have cases that we treat exclusively as Title IX. We also have a non-Title IX sexual misconduct hearing. And we do that kind of as a workaround. Well, not as a workaround, but the cases are just different. So we have different procedural protections for both cases. Our state system bifurcated the process into two very distinct processes. So not only are practitioners navigating potential and ongoing changes to federal regulations or the threat of those changes, the 2020 regulations took a previously singular process and said the threshold for a Title IX process is here, but as an institution or a state, you can set your own expectations. And so many schools did that because the Title IX regulations elevated what constituted harassment under Title IX to the extent that schools identified areas where, we have all this other stuff happening and we need to make sure that we have a process to respond to incidents that occur off campus or in spaces where our students are residing that maybe aren't part of our campus property. And so that's the example of the bifurcated process that Sadie is discussing. And in explaining that to a student, right? Sadie's talking about how are we explaining that to students, respondents in particular, as well as our complainants. It can bring confusion as well as some of that ineffectiveness across the processes. Joe shares there's nothing about the process, as we talked about earlier, you might remember, that encourages any kind of genuine accountability taking. Kevin adds, I don't think either party typically ends up leaving satisfied or feeling good about the process. We heard that earlier. And so a very specific sub-theme that came up in all three of the sub-themes was the length of time and how the lengthiness of the process does not serve any party. So in being beholden, what they're saying here is in being beholden to those regulations as well as state legislation or institutional policy, those processes, right, take time. And as students are, respondents and complainants are experiencing those processes, there's more room for them to either get support and conversely not feel supported through the process. And so the last quote that I'll share to kind of bring all of this together is from Rocky. And this one's a little longer, but I think Rocky does a good job of kind of summarizing all of this for us. Rocky says, we have legislators who think they know what the hell they're doing and they don't. They believe in the superiority of the American criminal justice system, and therefore anybody who's doing anything other is not doing justice to people. So let us write a procedure that is completely contrary to the philosophy of most educational institutions. Right, that last line is a little like in air quotes. There are different districts, there are different federal districts, there are different circuit courts of appeal that are making different decisions. You're going to get a different decision in the Ninth Circuit, California, Utah, than you will in the Sixth Circuit, than you will in the Fifth Circuit. So it's not only a matter of you have state legislators trying to tell the administration, here's what you need to do. You have different courts that are making different decisions. And so that becomes an even bigger problem because not only do you have administrators that are trying to keep up with what it is we're supposed to do today in terms of the regulations, what is our state telling us, what are our judicial jurisdictions telling us, whether it's state court or whether it's federal court, circuit courts of appeal, but now you also need to know what the Ninth Circuit did, even though you're in the Second Circuit. And so you have this giant tornado of information circling around. And again, going back to what Julia said, many, many folks in this work come to the work through social work, student affairs. Of course, folks come with a law background, but by and large, we've got folks who are trying to, they've shared with us, they're trying to decipher all of the moving parts and at the end of the day, seeing the need to provide holistic support to our students within the context of a system that, as Rocky poignantly points out, many people have a stake in. And so there was a lot to think about here and so many more quotes that we could share, but hopefully, Julie and I have been able to highlight for you that as we have sat with and heard from the practitioners who are working with respondents, whether in a support or services role, they're working with their institutional policies, state and federal policies, expectations from the institution about what their role is. And then at the end of the day, working to meet students where they are within the context of all of the policies happening at the same time. And so I'll turn it over to Nandika to close us out.
So we wanted to briefly touch on a couple of the implications for practice from everything that Megan and Julia have just shared. These are things that you may have identified as you were listening as well, but the need, as that quote from Rocky just illustrated, the need to engage policymakers and legislatures, particularly folks on the ground, right, who are doing this work every day, engaging those folks. The need to create spaces for professional development that are not rooted in frameworks of compliance, those processing spaces, the informal and formal coalitional spaces across states, across the country, within organizations, right? Some participants talked about having, I remember one in particular mentioned having a weekly, like, I messed up meeting where case managers and folks, different kinds of folks, they were Title IX folks from across campus came together and had a processing space for each other to support one another and improve their work and be able to engage more effectively. This includes having more research, having more spaces to understand why students are engaging in harmful behavior, so we can continue to create those formal and informal interventions to interrupt these harmful behaviors and prevent violence. And also spaces, including research that examines survivors and complainants' needs around accountability, particularly this idea of accountability versus punishment. Another implication is to center the healing of all people, including those who engage in harmful behavior, because as practitioners in this study noted, that encouraging and facilitating that healing has the potential to lead to behavior change and to preventing violence and harm on our campuses. And that the need for spaces for creative problem solving, such as that meeting of the I messed up meeting that one participant mentioned. We won't spend too much time on this, but this is the framework from SORED that talks about the differences between accountability and punishment. That I think for us really highlighted a lot of what many participants in this study talked about. This idea that accountability is something someone chooses to do versus punishment being imposed upon them. Therefore, accountability, is active, right? It requires change in behavior. It requires that reflection, that perspective taking that participants were engaging in, that understanding of one's own experiences of trauma and socialization, so that they can move toward change, move toward repairing the harmful behavior that they have engaged in, and to not doing that in the future, right? And in contrast, I think a lot of to punishment that severs relationship and connection, a lot of the work and philosophies that practitioners in this study, how they approach their work was really from this place of deepening relationship and connection that Megan and Julia were highlighting, in particular for some folks being rooted in their background as counselors, as social workers, and student affairs professionals. So we wanted to say thank you to the participants in the study. I think we didn't note, but all of the names used are pseudonyms. We wanted to say thank you to them for sharing their perspectives and their experiences, and to say thank you for listening and engaging with the findings of the study. Feel free to reach out with any questions. We're happy to share more information. We also have a report about the study that will be housed on the NCVP website along with this webinar. So feel free to share both with your colleagues. And thank you again. Have a wonderful day.